Hi everyone, my name is Madison Alexander and I will be presenting for my group today. Along with me was Lorena Hurtado, Habiba Jabbar, and Andrea Mesa. And our group project is called the Alachua Health Program, and it focuses on obesity and overweight in Alachua County. So first, a little bit of a background on our topic. Many people already know kind of what obesity is, but what does it really mean? It is defined as a serious medical condition of having too much body fat. It happens by consuming more calories than burned. So what are the consequences of obesity? Obesity can lead to many other crippling conditions. The list of these goes on, but two very important ones are heart disease and type 2 diabetes. So how prevalent is obesity? Throughout America, 42.4% of adults are considered obese. And to break that down even further, 27% of adults in Florida are obese. And then looking at our target population, 48.6% of non-Hispanic Black adults in Alachua County are considered obese. So as I mentioned before, our intended audience is non-Hispanic Black adults in Alachua County. Obesity continues to be a significant health problem, and research has shown that in Alachua County, the non-Hispanic Black population are disproportionately affected by obesity. If you look at the chart on the right, you can see in 2019, the gray line, which represents our target population, is much higher than the blue line, which is the state of Florida. Disparities in race continue to be shown, and we want to help this population and chose them for our topic. Next are the goals and objectives of our program. So the goal for this program is for non-Hispanic Black adults in Alachua County to first understand. We want to educate and make them understand the factors that contribute to obesity, ways to prevent it, and the consequences that result from the disease. It is crucial to make sure that this stage is reached because a true understanding will lead to a better lifestyle and modifying behaviors. The second goal is belief. We want them to believe that obesity can have negative consequences to their health and that positive behaviors can help prevent obesity along with other diseases that are associated with it. Belief is crucial because we need them to know that they have the ability to fix this. If they are obese, it's not too far gone. You can always change it and you can always lose some weight and get healthier. We also want to emphasize that there are negative consequences to obesity. We know that many people may get away with being obese and not have any other consequences, but over time, this may add up and it may lead to other consequences as previously mentioned. And then lastly, with understanding and belief, our main goal is to modify the behaviors to enhance health and reduce change of becoming obese and overweight in our target population. The next topic is our communication channels. So the overall aim of this communication strategy is to inform and raise the intensity of consciousness among non-Hispanic Black adults in Alachua County about the risk of obesity. Preventing obesity by promoting attitude, knowledge, and communication skills that makes healthy eating practices achievable. We will incorporate more health information into the community by bringing connections through events. Next, we'll have media advertisement using Facebook and Instagram as our main platforms. And finally, we have outreach in person with flyers at places such as churches, marketplaces, and schools. Together, we will reach our target community. So how will this program actually be implemented? So the Alachua Health Program is implemented to address overweight and obesity and improve the health of African Americans and people of African descent in Alachua County, Florida. Website and social media pages, as mentioned, will be developed to raise awareness and provide access to health education materials, events, and program activities. Our health communication messages and program materials were developed and tailored directly to our population through specific needs and unique challenges of our population. We will establish relationships with the news media outlets, community leaders, institutions, churches, hospitals, and health providers to help spread the message and promote the program. The more bodies that we can connect in this program, the better results we will have. Next, mailers will be sent out to county residents to start getting the word out. This means door to door, we will have information sent to our target population to help reach the spread. And then we'll have program flyers that will be provided to local healthcare providers to share with their patients. Whether they're in there for being obese or not, if they are identified as being in the target population, we want them to be able to be reached. The next step in our implementation plan is our program launch. So program launch and activities will take place during the entire month of April 2022, with its kickoff date taking place on Friday, April 1st, online, at select local churches, and at UF. April is National Minority Health Month, and it is a time to raise awareness about health disparities that continue to affect racial and ethnic minority populations. This is an ideal time to build awareness about overweight and obesity and promote the Alachua Health Program. Our health communication messages, program materials, and program registration link can be accessed on the Alachua Health dedicated website. The website and social media page will run promotional ads during National Minority Health Month and host weekly giveaways with winners receiving items such as portion control plates, grocery store gift cards, kitchen scales, and workout gear. Our signature hashtag Alachua Health, will help gain traction on this campaign. UF and a select few local churches were identified as appropriate settings for this target audience to deliver the health intervention. Attendees at the in-person outreach events held at the University of Florida and participating churches will receive goodie bags with tape measures, journals to record meals, healthy recipe books, etc. And a celebrity chef will also be used to host cooking challenges at these participating events. Alachua Health will be pilot tested for a period of 6 months, utilizing a pre-test and post-test design. Participants will complete surveys and questionnaires prior to and upon completion. Participants will also receive baseline measurements with follow-ups, monthly weigh-ins, pre- and post-program biometric screenings, and during the interventions, participants will track dietary habits and physical activity. Overall, this implementation and program will be launched to influence the overall target population that we have identified. So the next step is the evaluation plan. Our plan is to use a mixed method design, which is used to collect both qualitative and quantitative data when evaluating the program. The qualitative method will be used to gain in-depth information about one's understanding and motivations toward making changes. An example of that would be that we will use surveys which will allow us to understand an individual's attitude, progress, and challenges when it comes to obesity. As for using quantitative method, we will record individual physical changes as they would provide a true measurement of health improvements. Examples of this include measuring BMI, blood pressure, and cholesterol levels. This concludes our brief overview of our presentation. Thank you for listening, and here's a list of our references.